How can we guide them consistent with our values, beliefs, principles, and canons of both the faith and the cultural institutions? That's the guidance, and that's how we are going to move. I would like to ask the technical team, before the Mufta speaks, to allow me, give me the list of the people who are online, because he needs to know who he's talking to. And if they can sign in by organization, district, and faith that they are representing, because he's going to leave out their recognition, and that will not be right. Before it went off, I had seen Father Deus Ndiachira. I had seen Father Deus Ndiachira from Ntoroko. Is our women, children, and adolescent health champion. And actually was supposed to come and share the teenage pregnancy experience we are implementing in Ntoroko, but he could not come because of restrictions. If I can get a list kindly, or you can project who else is there so that they are recognized. Also online, we're joined by Bishop Amos Magezi, Bishop Amos Magezi, who is our board member, but also a family planning champion. If we cannot get this right now, we'll recognize them as we move on, but there's a secretariat, right, who is online. Because we are supposed to be 60 participants, we reduced the number to 20 to 25 today, so we expect the other 30 to be online, and it's important that the guests in the room know who else has participated in this dialogue. Now, I have a background and training of interfaith proper, because I worked with, we have 50 online, but let us get the details so that they are recognized later. So we have 50 participants online. And the categories will be given so that they are recognized, because we are even supposed to be joined by partners like UNFPA and others. So I was saying that I was trained and groomed by most of the interfaith leaders that are in this room, and I've worked with the Interreligious Council until I moved on now to continue the mission and the ministry, where we are working with Faith for Family Health Initiative. It's not very parallel to our Interreligious Council, but for us, we came in to address issues of our policy and also capacity building, especially on reproductive health, family planning, and other healthy issues. So by training, the little training I received, I don't have any mandate whatsoever to invite His Eminence. So I will invite the board member representative, Father Constantine Bonavinji, to come and invite our chief guest today and give the keynote and opening remarks. Father, you're welcome.
Thank you very much, Jackie. Protocol observed. You know, I've worked with the Sheikh for many years, and I think he knows me, and I know he knows that really I'm a person of few words, though my name is Mbonavingi. And my task is only just a small one, to invite him, because he's the big drummer, and when the big drummer has sounded, the small ones have to. So I'm inviting the big drum. Sheikh, whom I've worked with in the Religious Council of Uganda, and now as the Secretary General of Uganda Joint Christian Council, still I'm with him in interfaith. So Sheikh, welcome. And last year we were unable to meet, you know why. I would have liked to say, please let us get together, but you know why, we could not meet. But we thank you for the work you are doing, and even the guidance you are giving to the nation. Thank you very much. Please, I request you to come and address our guests.
Thank you, Father Mbanavingi. I've just learned from Jackie that you have to have your own microphone and don't let it go to any other person. That's why I've taken that lesson. So maybe this one can be accepted. Thank you very much. Bismillah ar-Rahman ar-Rahim. In the name of the Almighty God, most gracious and most merciful. Our dear religious leaders present, to mention my co-president, Apostle Dr. Sarada, the presiding apostle of the Born Again Faith Community in Uganda, member of the Council President, Inter-Religious Council of Uganda. His Eminence Sheikh Muhammad Ali Waisa is the second Deputy Mufti, and also a member of the board, Inter-Religious Council of Uganda. Representatives of the remaining faith-based organization is here present. The cultural leaders, to mention the Prime Minister of Toro and the Prime Minister of Dingia Wamba, present, and other representatives from the Buganda Kingdom and the Busoga Kingdom. Dear donors and partners in this struggle, the Executive Director, the FHI Initiative, and your team, dear friends, participants, ladies and gentlemen, Assalamu alaikum. Peace be upon you all. Our topic today is investing in adolescent matters. A report by Adolescent Health Commission underscores the importance of investing in adolescents. Improving the physical, mental, and sexual health of adolescents aged 10 to 19 years at the cost of $4.6 per person per year would bring a tenfold economic benefit by averting 12 million adolescent deaths and preventing more than 30 million unwanted pregnancies in adolescents. Similarly, programs to reduce child marriages at about $3.8 per person can bring an almost six-fold return on investment and cut child marriage by around a third. Further, the global strategy for women's, children's, and adolescents' health points out that increased and sustaining financing over the next 15 years would yield at least a tenfold return on investments from social and economic benefits. This one, better education attainments, workforce participation, and social contributions, as well as at least $10 billion in demographic dividends from investments in early childhood and adolescent health development. We need to reflect on these statements. We need to bring this reality home. At 9 million, adolescents make a quarter of the population in Uganda, yet life is harsh for many. Poverty, HIV and AIDS, early marriage, teenage pregnancy, gender violence, and a low participation in secondary education make it difficult for younger people to fulfill their potential. According to the Ministry of Health, 25% of Ugandan teenagers become pregnant by the age of 19. Close to half are married before the 18th birthday and continue having babies into their mid-40s. Early motherhood tends to compete with formal schooling and career development and has the capacity to affect a young girl's life options in crucial and profound ways. Uganda has one of the world's highest maternal mortality rates, with 18 mothers dying every day in pregnancy or during and after childbirth. Majority of these deaths are from adolescent and young people. According to Uganda Bureau of Statistics 2021 report, despite the high primary school enrollment at 91%, the net secondary school enrollment is at 27%. In Uganda, the child labor stands at 28%. Adolescents and young people are at higher risk of contracting HIV. Young girls are the most risk. 2/3 of all new HIV infections are contracted by adolescent girls. The traditional practice of child marriage and female genital mutilation and cutting persists in many communities. In 2013, Uganda was ranked the 16th out of 25 countries with the highest rate of child marriages. In the Pokot community in Amuda district, Karamoja, almost all girls, around 95%, have been cut to make them marriageable. Both practices are devastating for girls' physical and mental health. Dear friends, as we reflect on this, it is dawning on us that young people and adolescents are in danger of losing their future to unplanned pregnancies and a never-ending cycle of poverty. A more profound question to all of this and to us is, where did we go wrong? And what do we need to do to remedy the situation? On the question of where did we go wrong, I wish to leave this for this gathering to discuss. However, allow me to mention a few challenges to adolescent health. One is that there is a lack of data-informed decisions and actions. Two, the weak prioritization of adolescent health in government programs and the budgets. If during the past campaigns, one of the presidential candidates was using securing your future, there was that securing your future. Is there any deliberate effort to secure the future of our adolescents? That is the question which remains. How are we securing the future? We above the age of 50, we are being given priority to priority access to AstraZeneca, and also, so that we may at least continue to live. But the younger generation, I think they are around 70%, the future is theirs. But for us, the future is dim. We need only we're advised by by our doctors to eat fruits, mostly. Not so? And greens, not red meat, not fat, not sugar. So is that a future? But these young ones need all of that. Let's look at the budgets now. Is there a deliberate move to secure the future of our young ones? So there is a weak prioritization of adolescent health in government programs and the budgets. Another one is the COVID-19 and other pandemics. Poverty, poor parenting skills. We have harmful social-cultural practices and norms. These are also contributing to the problem. There is lack of leadership and life skills among adolescents. Friends, on the question of what needs to be done, I'm quick to observe that the faith community are recognizing the importance of providing safe environment for younger people. All places of worship, we say the mosques and churches, faith-based schools, are places where moral values are formed and strengthened. Self-esteem is cultivated and life's lessons are taught using the holy scriptures, that is the Quran and the Bible. I would like to applaud what Faith for Family Health Initiative 3 FHI and their faith partners are doing in improving the health outcomes of adolescents and the younger people in this country. Thank you very much. God bless you. For instance, jointly with the faith-based organizations, 3FHI is supporting even the local government to develop teenage pregnancy prevention framework. Similarly, 3FHI is collaborating with the network of faith and religious leaders to replicate the same model in Toroko district. And in Namayingo, the Chenjojo, 3FHI is working with the FBO's network to monitor government program commitments and adolescent health. All these efforts are possible because donors and development partners have provided resources. They have also provided tools, skills, and a platform to implement these programs. On the other hand, government is developing policies and programs to promote adolescent health. With global challenges, technological advancement, changing society, new pandemics and endemics, the health needs among young people are also changing. We must also share in these changes. We must act swiftly and innovatively. It is for this reason we are gathering here today to learn, engage, and share skills, tools, and resources to enable us to mount a whole system approach to address health needs of our young people. As we do this, I would like to remind you that the Constitution of Uganda guarantees all Ugandans' right to quality health care. We all must support adolescents and young people enjoy this right. I welcome you once again to this meeting, and I declare this meeting officially opened for God and my country. May God bless you. Thank you.
Thank you so much, His Eminence, for the powerful keynote remark and opening this important dialogue. I would like to check if our friends online are listening in. Can someone online, if Bishop Magezi or any other senior religious leader online, can you, on behalf of people online, give a vote of thanks to His Eminence for this powerful keynote? Is Bishop Amos online? As we wait, it's very important to keep recognizing people who are online, because they also set aside this whole day to join us. Is Father Motegeshi Robert, board member at FHI but based in German, online? If Bishop Magezi is not online, can we get Father Robert? Okay, let's keep checking, because the information I have is that they registered. If they are facing technical challenges, we need to get everyone, so that at the end of the day, when we make a commitment, we have representation as it was supposed to be before these restrictions. Thank you so much, His Eminence. Just a simple correction as introduction. I'm Jackie Katana, Executive Chairperson not director, for purposes of declaring conflict of interest that I will explain later. So I was entrusted by a team of eminent religious leaders that will introduce later in the day, that we can engage, do resource mobilization to advance policies in health, but also continue to build the capacity of religious leaders. And now we've been joined by the cultural leaders. So the current project that you found us concluding, we are joined by cultural leaders. We are not in any way parallel to our main bodies, but we are looking at a gap that is existing and complementing what is ongoing. So thank you so much. At this point, let me hand over to Charles, the National Director, SRH Alliance. We start our dialogue, and the people on machines, they make sure that all the people are going to present. Now, on the program, there are quite a number of people that are going to speak, but we agree that they speak wherever they are. So they are going to have online statements made, and a few that are in this room are going to be on the panel. So we have very eminent people online that are going to also address us. Thank you. Over to you.
Thank you, His Eminence, for the great and inspirational opening remarks and officially opening this dialogue. And it means a lot for us to have you here in this dialogue. It shows how much you, the leaders in faith, really prioritize and feel that there needs to be action towards addressing the challenges faced by our young people. Many times out there, the adolescents, they faced a lot of challenges. Like during lockdown, we thought that the initial pandemic was affecting only adults. We abandoned the young people, but you saw what happened. The media reports of teenage pregnancy, violence against the young people, and that really pointed to the fact that as the leaders in faith, this is an area that you need to pay attention to. And through this dialogue, we hope that we will be able to have actions which are driven and guided by you, our eminent leaders in faith. That is our hope, and we hope that we'll continue to work together in that. Thank you very much, Your Eminence. A big hand clap for His Eminence for the great introduction. Yes. So we are moving into statements from different partners that we have who are working around adolescent health in the country. We shall be getting statement from UNFPA, and we shall also get a statement from Ministry of Health. Technical challenges around linking up with Ministry of Education and Ministry of Gender, but along the way we shall also get them on board to give their statement. We shall also get a statement from the young people. They also want you to listen to them. They also have some perspective to share. And after that, we shall listen from the leaders here in the House based on your opening speech, but also based on the statements made and the issues that came up from the previous discussion. We want to begin to build toward some of the actions that we can move out of here with, and how we can strengthen our actions on supporting our adolescents. So I would like to check with the technical team. The first statement is coming from UNFPA, and so I would like to give the opportunity and invite the Senior Policy Advisor from UNFPA, Abdi Batuta, who is joining us online on behalf of the country rep. Our technical team, is everything set? Ladies and gentlemen, let's listen from the statement made by UNFPA. Thank you.
Good afternoon, everybody. Thank you for having us here, eminent religious leaders. As introduced, my name is Batula Hassan Abdi. I'm the Senior Policy Advisor for UNFPA Uganda Country Office, and I'm happy to be here. Eminent religious leaders from all denominations, MOH officials who are present, Ministry of Gender, Ministry of Education, colleagues from the NGO world, SRH Alliance colleagues who have organized this. Assalamu alaikum and good afternoon. It's on behalf of the UNFPA representative who was not able to attend this meeting. I would like to give the statement. On behalf of UNFPA, it's an honor and a privilege to be here today with you on this important occasion where the highest leadership of various faith leaders in Uganda converge to discuss an important issue, adolescent health, and a critical matter for Uganda's development trajectory. UNFPA and other development partners acknowledge the importance of interfaith platforms in promoting unity for harmonized positions on pertinent issues, among others, good governance, peace building, and specifically on sexual reproductive health and rights. This platform exemplifies the principle of community ownership of challenges and solutions as key to sustainable development. We are gathered here today with the understanding that you as the religious leaders can bring a formidable change from within and without. And religious leaders speak to the hearts of people. As for us, the development partners and development practitioners, we speak to the minds of people. So your influence is formidable. UNFPA can attest to the importance of engagement of religious leaders, both globally and here in Uganda. We appreciate the partnership of mutual respect that UNFPA has enjoyed with the Religious Council of Uganda in the last 7 years, and I'm encouraged by the achievements this far. The partnership has resulted in obtaining religious leaders' support around issues on sexual reproductive health, including HIV, prevention of gender-based violence, including policy formulation and consensus on religious leadership tools and community mobilization for social norms change on SRHR and service uptake. We have witnessed the religious leaders have developed a common message on sociocultural norms that negatively affected the Ugandan women and girls. They have translated them into public commitments to champion social change, for example, ending female genital mutilation, in mobilizing people around SRHR, and preventing GBV and teenage pregnancy. The harmonized policy guidance framework in form of pastoral letters were endorsed in early 2019, and we look forward to the implementation and the outcome of it as well. Ladies and gentlemen, the road to universal coverage is, however, very long, and the task is enormous when we talk about sexual reproductive health, specifically for young women and for young people in general. Several barriers constrain access to especially reproductive health information and services, particularly for girls, women, and young people. On the other hand, the health and the social system are not fully developed to deliver a package of integrated sexual reproductive health right as we have gathered here today to discuss this matter. On the other hand, layered inequalities in emanating from social cultural norms and practices and low socioeconomic status of women and girls and young people in general make informed choices and act on them, access and services that they need. Girl child specifically is not able to enroll and complete education, and we know the role of education in development. We know education is a social vaccine. However, many girls are not seeing through to the end in this area of education for girls. Therefore, it is depriving the girl the opportunities to develop her skills, her competencies to apply in the future to lead a healthy, productive life. She is likely to transit in childbirth with societal consent, unfortunately, and which leads to child motherhood, often in abusive relationship, with high chances of losing her life and suffering related disabilities like fistula. She will grow into a womanhood lacking autonomy and resources to make choices regarding her sexual reproductive health needs. As a result, she's likely to end up with more children than she can cater for, and thus fueling the vicious circle of poverty. Those difficulties not only hinder the women and the girls to reach their potential, they limit the access to decent jobs and opportunities, and also affect the sustainable economic development of Uganda in general. Those inequalities facing girls and women and young people stand the way in the attainment of Uganda's aspiration to harness the powerful youth population that it has to increase the economic productivity and propel the country to a middle-income country by 2030 and harness the demographic dividend, which in short we call the DD. In simple, the DD, I am sure you heard this presentation yesterday, it means a positive economic growth achieved by a population structure that has more working adults and less dependents. However, it is important to note that harnessing DD is not automatic unless we make the right investment. Uganda has therefore identified key strategies for harnessing the DD or the one-time opportunity that is arising from the youth bulge. And these drivers are also called the game changers, and the government has come up with a clear plan. And I'm sure in your presentation with the National Population Council, this was already said. But the key strategies or the game changers are keeping girls in school, and we know the importance of keeping girls in school, promoting family planning, improving child survival, strengthening organized urbanization, promoting social protection, and achieving gender equality and equity. It takes leadership. It takes strong partnership that focus on a common result, and it takes commitment, and it is possible. Religious leaders in Uganda hold the key to the social transformation. In 2010, religious leadership, resolution on maternal and HIV and gender-based violence were crucial turning points. Foundations for collaboration and consensus building for mutual respect and understanding. We have witnessed religious leaders work in partnership with the government through the Ministry of Education and Sports to dialogue and reach consensus on the National Sexuality Framework. We encourage Sexual Reproductive Health Alliance and the interfaith leaders to continue with the good work that has been started, particularly in the area of adolescent health, to act as a springboard for opportunities for harnessing the demographic dividend. So what are the key opportunities for harnessing the demographic dividend? I think the youthful population is a key one. 55% of Uganda's population is below 18 years, and this provides an opportunity for investing in them and making sure that they come to the labor market healthy, informed, and educated in a competitive market. Investing in adolescent health is cost-effective intervention, such as reducing unmet need for contraception and preventing unintended pregnancy. The cost of preventing unintended pregnancy is far lower than the cost of providing care for unintended pregnancy. In this sense, improving young people's sexual reproductive health will enable Uganda to reach a middle-income status as per the vision of the country, which is stipulated in many development blueprints, like the National Development Plan 3 and the Roadmap for Harnessing Demographic Dividend. The benefits of keeping girls in school will end the vicious circle of poverty. Young people's skill development is key to make sure that they are employable and they come to the labor market with the right skills. The role of religious leaders in enhancing sexual reproductive health and well-being, as well as harnessing the demographic dividend, cannot be underestimated, ladies and gentlemen. Faith leaders influence and shape the opinions at community level on narratives that have bearing on adolescent health and well-being. They also play a crucial role in advocating for investment in DD, game changers within and without the religious leaders' platforms and structures. Besides, religious leaders and institutions command a following of over 90% of the total population in Uganda, majority of which meet on weekly basis. This makes it possible for easy dialogue and information sharing. Faith-based institutions encompass the nationwide network of non-for-profit health facilities, through which 43% of the health facilities in Uganda are delivered. 87% of the education services reach children and adolescents as well. UNFPA is committed to work to enhance the fulfillment of sexual reproductive health and rights for Ugandans, especially empowering the young people to live their dreams and reach their potential. We value the partnership with the faith leaders and institutions such as SRH Alliance to support young people to live their dreams. We know what works. We need to scale up what works. Thank you very much, and I wish you a good discussion. Thank you, and over.
Thank you very much, Abdi, for joining us online and for the great deliberation and statement you have made. And I think what is really very core at your statement is that as a country, if we want to dream about demographic dividends, then we should invest. Like His Eminence said, we should invest and prioritize the adolescents' health. And with that, allow me to invite, so that we can save time, Dr. Mugai, who is here with us on behalf of Ministry of Health. Doctor, you are welcome to come and make the Ministry of Health statement. And I also want the young person to be very ready so that we can go into discussion. We want to hear from the eminent leaders here in the House about how we can strengthen the adolescent health programming. Thank you, Dr. Mugai, you're welcome.
I was alerting him that if we could spray this with some sanitizer, would probably avert His Eminence Mufuti's fear of having using different microphones. It's true, microphones have been a source of issues for some time. I'll be very brief. First of all, I'll make my personal comments, but I've also received a communication from the Assistant Commissioner in charge of Adolescent and School Health, Dr. Dina, who is probably listening in. She has alerted me that the team online, and Jackie, I think, take note, the team online is not hearing everything. They have some issues. I think that's why you called someone and you couldn't reply. So she has sent me this message, but allow me, for the sake of repeating myself, also mention I'm the Assistant Commissioner for Reproductive and Infant Health. So we work very closely with Dina. When the young people get pregnant, they throw them to reproductive. They become reproductive. And we are the duty bearers. So our commitments are in line with our responsibility, primary responsibility, as the people who are tasked with the responsibility of being duty bearers. We must have a clear understanding of what the problem is, as I mentioned earlier on, a clear understanding. And if we are talking about teenage pregnancies, it is teenage pregnancy. 25% is an abnormal number. If we are talking about unmet need for family planning, unmet need for family planning. If we are talking about abortions, actually in one of the slides I was meant to present, abortion or sepsis is the #1 leading cause of maternal death. Abortion or sepsis. You know, Uganda is a very interesting country. People listen to message that has some bit of death. When we are communicating COVID without death, then the message will not go. So abortion or sepsis related to abortion is the #1 leading cause of death amongst young people, 24 and below. The highest number of deaths, according to our report this year, of maternal death in this country is in the age group of young people. So I wanted to make that preamble that the problem is real. The problem needs every one of us, and our commitments today are in line with our primary responsibility as duty bearers. Allow me, distinguished people, the message from the Assistant Commissioner for Adolescent and School Health at this important dialogue of the Interfaith Adolescent Health Dialogue of 2021. Adolescents and young people aged between 10 and 24 years constitute 34.8%. That's approximately 35%. And this, in a population of 42 million, translates to 15 million young people, that is 10 to 24 years. And over 48% of the country's population is below 15 years, according to UBOS. Over 90% of the young people are raised up in faith-based environment, and hence their challenges can also be addressed from the context of the religious-based or the faith-based organizations. Ministry of Health, Uganda appreciates such a platform that engages different faith leaders to deliberate on SRH issues of young people growing up in the faith-based environment and how this can be supported for them to live a healthy and productive life. On this, the Ministry of Health recognizes all the incredible efforts and contributions being done by all various religious fraternities in promoting access to quality health information, services for adolescents and young people in Uganda. We remain committed in working with all religious institutions in promoting the physical and mental well-being of all adolescents in the various communities in Uganda. On this important occasion, we commit to 1, collaborate with the faith leaders and their respective institutions in strengthening and promoting health education and life skills development for adolescents and young people in general. 2, work with community faith-based institutions and groups at the grassroots to strengthen family-based care services and information access to adolescents. 3, provide capacity building to strengthen youth-friendly services for the faith-based institutions, especially those providing youth-friendly services, maternal and child health services, and also psychosocial services at our health facilities. Those are the 3 commitments on behalf of the Ministry of Health as a duty bearer in this occasion. Thank you so much.
Thank you, Dr. Mugai, and thanks for making time to be with us here. We also appreciate the commitment from the ministry and our leaders who are online and those who are present here. The Ministry of Health is committed to work with us and support and make sure we play our role under your leadership. And with that, to save time so that we can go into discussion, I would like to invite the President of the Youth Advisory Committee. The Youth Advisory Committee is a team of young people that help to make sure that our partners that work under the Alliance are compliant with the needs of young people. And whatever work they're doing, they are really meaningfully involving the young people. And so Claire is the president of the Youth Advisory Committee, and she will be making statement on their behalf, and thereafter we go into discussions. Thank you.
Good afternoon, ladies and gentlemen. Eminent religious leaders, UNFPA, Minister of Health, Minister of Education, Minister of Gender and Social Development, young people in the House, SRH Alliance, protocol observed. My name is Nampenja Claire, the President of the Youth Advisory Committee under the SRH Alliance Uganda. I'm here to voice out the needs and the asks of young people across Uganda. With the young people, commend the efforts of the religious leaders for actively getting involved, together with parents and the state, in nurturing us by equipping us with values and skills required to grow into adulthood. Your obligation to protect young people and to consider their own experiences and perspectives and fundamental principles contained within most cultures and religions. We, the young people, are willing to work with you in your different capacities to promote adolescent health, both in and out of school, while upholding our religious and cultural values. We therefore recommend the following. Religious leaders to integrate adolescent health promotion and education in the existing programs to enable awareness and health choices in and out of school. Religious leaders to include us in the decision-making structures of the different faiths to ensure that our voices and concerns are addressed sustainably. Through existing religious structures, adolescents and young people are supported, access sexual reproductive health and rights information, services and nutrition, especially those living with HIV and with special needs. Faith-based schools when reopened to allow integration of SRHR information and education in the school curriculum and enhance awareness and curb various SRHR challenges. Religious leaders to create a conducive and safe environment for dialogues on various SRHR issues like teenage pregnancies and child marriage, among others. Religious institutions to initiate innovative empowering interventions to target the education and skilling of teenage mothers and also nutrition for young people living with HIV. I, Nampenja Claire, stand here today on behalf of the young people out there to request the religious leaders here present physically and virtually to join hands with the different line ministries, CSOs, and private sector to further readdress and give a platform to address the fundamental adolescent health issues that are consistently hindering the realization of young people in Uganda. For God and my country.
Thank you, Claire, for that voice of young people, for delivering it very well. And The biggest message is that the young people are requesting that we have to be proactive. We have to guide them. Let's have program. When we don't guide them is when we don't guide them is when they go the other way that we don't want. So we have to be proactive. Let's create the space. Let's listen to them. Let's have counseling services for them within our operation. That's when we can be able to keep them well guided and they will comply with our values. But every time we leave them out is where they go into the space that we don't need them to be. Thank you very much, Claire. We will pick a few comments based on the statement so far. We still have one from Minister of Gender, and then thereafter we'll move into the next session. But I want to pick some few comments from the eminent leaders that we have here based on the statement made so far. Then we will have Minister of Gender come in last. The microphone is available and it's well sanitized, so we will be able to listen from you. Anyone who has a comment so far, both online but also those who are in the physical audience here. Yes, there's a comment from Reverend Watt.
And health. Thank you, SRH Alliance, for this organization. It is very, very important. I like the statement that was made by the representative of UNFPA, that we know what works and we need to scale it up. And why do I emphasize that? Before we look at the adolescents, of course, we know the needs of the adolescents. We have children, we have worked with young people as religious leaders, we have institutions and structures in our faith institutions well laid out. We have concern for our young people. So what we are sharing here is not new. But there are gaps that we need to emphasize here before we even endorse what we want to consider to be a statement from us. SRH Alliance, you are doing a great job to bring us together. But like the young person highlighted, integration of adolescent health is already in place for us religious leaders. What is missing mostly is involvement, meaningful participation of the religious leaders and the cultural leaders. That is what is mostly missing. I want to be negative here for purposes of bringing about unity. We cannot afford to be called to endorse what you have already decided. We can't afford. We can only embrace what you want us to do with you only if we have been part of the process right from the start to the end. And I'm an expert on community engagement through my church and through other avenues. I'm a public health specialist, and therefore, if you want people to embrace the promotion you want to, whatever issue you want to promote, they must have what we call buy-in and ownership. What the biggest gap we have in our programming, first of all, is lack of the cultural sensitivity, and therefore the language matters here. What language are you bringing to me? You are talking of family planning among adolescents. I'm a public health specialist. I know what family planning means beyond contraceptives. But if I'm to explain to my religious leader who has not done public health, what language do I come with? We see us endorsing documents that are usually taken up by other architects of what they want, and before we know, we have been overwhelmed, and then we begin rejecting what we have endorsed. Can we avoid that in our approach? I want to be open. Resources is the other issue that we must consider for religious institutions. Resources. We want to see dollars on table of religious institutions and cultural structures in order for us to be relevant to our constituencies. Minus that, we can't do much. Am I talking? Yes. So here we are as a dialogue. This is a dialogue. A dialogue is about discussing the hard issues and the soft ones. So the dialogue here, if we have to help our young people, it has to be as transparent as it should be. It has to be meaningful. It must ensure meaningful participation of the key players. And resources is part of this game. I must say it, and I will continue saying it, even out of here. So, SRH Alliance, let us be on the table of deciding which resources we must use and how we are going to allocate them and for what. That is very, very important. But the issue is we are ready to support you, actually to support ourselves to do what we must do, if everything else is right. Thank you very much, and God bless you.
Thank you, Reverend. That's really a very important submission that we have noted there, and we take it seriously. And that's why this dialogue is really to build that movement where the religious leaders are at the forefront and they're providing leadership and guiding on how things should be discussed. Yes, next comment.
Thank you so much.
I just request that we keep it quite brief so that we can hear from many.
This is Vincent Senyende from Buganda Kingdom. I just have 2 comments to make in reference to Claire, the person representing the youth. You talked about involving the youth, so the question here should be, to what extent do we involve the youth? The culture, the religious leaders, what is the extent of involvement? I won't call a 10-year-old girl to discuss, because they're talking about 10 to 19, to discuss things about which are beyond your comprehension. So to what extent are we involving them? And what age categories are specific for what specific messages? Secondly, I think that it's also prudent that we support the existing cultural and religious institutions' initiatives to bring about sanity in whatever we are discussing. If we bring about sanity in the way the adolescent girls are behaving and show them the right way to go through our religious channels, through our culture channels, I think there will be a better way to deal with the problem. And lastly, the key challenge I find here is that the adolescent girls who are especially out of school, their poverty is a key thing. What are we doing to address the poverty? So we should have key income generating activities for these vulnerable girls such that they can be sustainable. Actually, as I speak now, I need, I think, 10 girls now to go on some skilling free. They only have to come with their transport or lunch. but they will be joining mechanics and other kind of businesses. And if you have them there, the class is beginning tomorrow. We can offer them some vacancies on one of the programs I'm coordinating. So what are we doing to empower the young girls such that they're not vulnerable? Thank you.
Thank you very much, OH I think from these two submissions, we are picking two things. One is the issue around meaningful involvement of the religious leaders, and we said that this dialogue is building up a movement where we want the faith leaders to provide leadership and be more at the forefront rather than being involved. So, and this is not just stopping with a dialogue, but it's something that we want to continue building on. For example, like you're talking about the mentorship program, how can we support the senior leaders to be able to mentor the leaders that they work with and they supervise? So this is going to be a process where...
NBS happening now.